My name's Steve Harrington from Glastonbury. I understand, Congressman Larson, that the law of the land is Obamacare, and so be it. I'm fine with that. But reading into it and knowing the gatekeeper of Obamacare is the IRS, I actually have not been very upset about what the Tea Party's been doing by trying to block it, because I don't know if any of you people are aware, but Obamacare, if you don't pay into it, the IRS will be on your back, and they can levy fines on it.
That's right.
And liens on your home, take your driver's license away. Is that true or is that not true? And if that's a yes or no question, Congressman.
Yes, the IRS is responsible in the event that you choose not to insure.
Well, my problem with the IRS, and I think I probably...
Well, but the question first is, you don't have a problem with the IRS unless you decide you're not going to get any insurance.
Well, they lost
Well,
67 million.
Why does Obamacare, I mean, Medicare and Medicaid are not enforced by the IRS? Why does Obamacare have to be enforced?
Ultimately, they are. They're enforced by the Treasury Department.
Yeah, but they can't put a lien on your house. You collect Medicare
Well,
that
that's,
you paid into.
no, they're not putting a lien on your house.
That's in the bill, I've read it. That is a true statement.
But it's the responsibility of the individual.
I get that. It's all like all fine print in your mortgage payment. You make your payment, you don't have a problem with the bank. I get that. The problem is, why? Let's face it, the IRS doesn't have a very high level of credibility.
That's right. They lost 67 million.
Matter of fact, I think it's probably lower than the rating of Congress. With all due respect.
That may be true.
I believe it to be true.
But how would we function without, are you suggesting we don't have any IRS?
No, sir,
Yes.
not at all.
Yeah.
There's corruption in everything, in the private sector, government. I get that there's a baseline in the sand, and I
They should
get
be
that.
accountable.
I'm sure everybody else does. I just am really nervous about the IRS being the driving force of Obamacare, and that's ultimately what it is.
Well, the driving force of Obamacare is the health and well-being of citizens.
Well, that remains to be seen, because it hasn't really worked yet.
Well, it goes into effect on the 14th, but you've already heard from people who are already benefiting from it. You think about all the kids with pre-existing conditions. So, listen, there are numerous problems with government. And the IRS, you can take any government agency and go down the list and find out problems that will upset anyone. But by and large, they're more often than not demeaned for what they do. And they perform a great service for the country. Okay, having said that up front, acknowledging that it's not like any segment of government or any segment, as you point out, of business or any place else, it's not without its problems, etc. Having said that, what is the constructive thing to do? The constructive thing to do is to work towards a more perfect union. And so here was a system that was devised and thought through by the Heritage Foundation, targeted, what's happened in Massachusetts? Have they seceded from the union? Are people not happy with their coverage? They're doing quite well. They're doing quite well. And so this is not, by any stretch of the imagination, the end of the world. In fact, if we were to work together, it's a direct means about which we can both control costs and drive out the inefficiencies in the system, instead of placing it on the backs of individuals who receive Medicare or Social Security or Medicaid. Yes, those are government programs, but they're programs that people pay for. Tell me I need to pay more. That's an argument. But to say that I should go without, or that I should lose my home, or that I can be denied because of a pre-existing condition, I think those are wrong-headed. I understand your concern about the IRS. You know, listen, I always think it's great that the American people in general should always have a healthy skepticism about government. That should always be the case. Or as my grandfather would say, trust everyone but cut the cards. And you want and expect that your government will do the best for you. When it fails, you have to continue to apply all the leverages that you can within the process to make the system work better. This is an attempt to make the healthcare delivery system work better. Maybe there is a better way for us to incentivize people and to say, but should we say to people, no, you don't have to get insurance, and if you don't, that's okay, there's no penalty for that. What happens when your family gets sick?
John, I'd just like to say I don't disagree with that type of stuff. I guess
But-
I speak for myself,
but
being a
that's-
father who tries to lead by example for my children. I would ask President Obama to lead by example by being the poster child for his own bill.
He is.
So, is he?
Let him have the
He
health
is.
care that he's chosen.
He doesn't get special health care, he gets what every federal employee gets.
Exactly. It's not Obamacare.
Wait a minute. So, wait a second. This is the misnomer. This is the misnomer. Anyone who has insurance currently, how has your insurance changed since Obamacare?
Gone up substantially.
Not at all.
Gone up.
Not at all.
Well, the law hasn't gone into effect yet.
Well, wait a second. So the law goes into effect. If you have insurance now, how has it changed?
Does it?
It doesn't. Okay, so let's be clear about that. For 90% of the American people, it doesn't change. And especially for everybody on Medicare, as the elderly have been scared into thinking that it's going to change for them, it is not. So, just like it didn't change for you, it's not going to change for the President of the United States or government employees, with the lone exception of Congress, who will go into an exchange because of a politically motivated amendment that Charles Grassley, who later says, I regret it, I didn't mean to do it, put in to the legislation. But it's the law of the land.
John, I see a lot of big companies now, all of a sudden, because of the Obamacare, dropped in health insurance.
That's right.
They had good companies paying money.
Who are they?
FedEx,
Home Depot.
FedEx, how much did FedEx drop their coverage?
for their spouses that they were co-opting for their employees.
Right.
Good companies that paid
Only for
good money for their
spouses who
people.
have coverage for
Now,
their work.
in a free democracy, all of these companies are entitled to do whatever they want.
I don't disagree.
Right. So that's FedEx's decision.
They're in a bigger pool now.
So FedEx gets to decide what they're going to do. And FedEx, if they choose, if that's what they've negotiated with their employees, and they're going to boot their spouses off, well, that's FedEx's decision to make.
Because of the cost.
Increased
Cost of doing their job. The increased cost of doing is under Obamacare.
The cost of insurance was the same, and in fact, the cost of insurance is coming down. And where was everyone in the Tea Party beforehand when insurance was skyrocketing through the roof? What was the solution that the Tea Party came up with? Goose egg. So let's be clear about that. And now that the cost of insurance is coming down, and now at 18%, what drives that cost? Obamacare? Where was insurance before Obamacare? It was at 20% of GDP. Now it's come down slightly. The goal should be to drive it down so it's effective and affordable for everyone. Instead of fighting around the edges over people who are going to get insured or not get insured, how about making the system more effective? The way to do that isn't by denying Obamacare. The way to do that is to make sure that we pool together our resources and do it in a way where we have coordinated care. As a public health and nurse official, you know the importance of that.
I know that there is an answer to your question. I can't give it here because I'm not going to be allowed to, but there is an answer to
Come on, I give it all the time.